Hello, this is Angelia, and you're watching the podcast Why You Do What You Do, a podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. Last time, we were talking about examples of differing viewpoints, and we're going to take up on that. And that we were talking about the Rorschach test, specifically. Suppose Henry J. is shown the Rorschach ink blots during an intake interview. As Henry looks at them, he turns red in the face and looks very angry. In addition, he indignantly refuses to say what he thinks the various designs resemble. We can come up with three interpretations of Henry's behavior. Number one, this is a sample of his widespread rage behavior when exposed to ink blots. I don't think anyone nowadays is going to make this diagnosis. Number two, this is a correlate of his behavior in evaluation situations. And some people do have test anxiety. So, some people are resistant, but probably not the case here. Number three, this is a sign of major underlying personality characteristic. Anger at experiencing ambiguity. Oh my gosh, my brain is bleh. Ambiguity. I got it out. Or a shame response. Like in the ink blots, you might see some people see naked people, or some bad thing happening, and he might be ashamed to say that because he thinks they put him on the spot on purpose. Like this is something nasty, and they knew that, but they want to see if I'll say it or whatever. And so he's blocking and saying, "No, I'm not going to tell you what that is." A clinician adopting the first viewpoint will probably develop a treatment program much different from a clinician who adopts the second or third. And honestly, if your clinician was to adopt the first viewpoint, I would say see somebody else. For the most part, different psychological philosophies account for the varying ways of interpreting behavior. Because remember, your behavior is the teller. How you behave tells the story a lot more than what you're saying. Therefore, it is doubtful that this problem can be resolved. Because again, different therapists have different ideas. So, like I said, as far as therapist goes, one size does not fit all. And I went to I went to two before I found the third one, who was a fit for me. So you might have to do that. And since everybody is different and all therapists are different, it just makes sense you're going to find one that fits you. Then you're going to be able to do the work necessary to heal your, mind to move on and have a functional life. However, certain attempts have been made, one of these being diagnosis by computer. That's a newer thing that's happening. Diagnosis by computer, this is the computer age. So it is hardly surprising to find that these versatile machines are involved in psychological assessments. Of course not. And if any of you applied for a job recently on computer, they do have some psych questions, that they're trying to figure out what kind of person you are before they even bother with you. As we mentioned earlier, at least one standardized interview format has been adapted for use with computers. And since standardized interviews yield better interjudge reliability, it would seem to reason that a computerized system would work at least as well. This has in fact been verified by Greist and Associates, who are reporting that computerization also shortens the process considerably. So if you go to a therapist and they want to give you a test on a computer, just do it. It's going to yield faster results than, weeks or months of therapy will, if they have to, ask you all these questions and you only have to be in there for 45 minutes or an hour, whatever your insurance pays for, or whatever you want to pay for. Just do it. Because time is a commodity that everyone values, computer-assisted diagnosis may become a popular assessment technique. And like I said, it has already. I've been to places, stores where my son was applying for a job, and sat there with him, and he's got all these questions he has to answer on this computer, and I'm like, y'all, come on. Personality test interpretations are also being computerized. The various elements of the test can be programmed so that a profile is obtainable when a person's responses are fed into the computer. The MMPI, in particular, lends itself to this process, and is the case with the structured interview formats. The time savings can be considerable. So it's all about saving time, and that actually saves you money. The longer you drag it out, the more it's going to cost you. So it kind of behooves you to let the therapist speed the process along. And in summary, if the many types of behavioral deviance are to be treated, they must be correctly identified and classified. Classification allows for quick and complete communication of information about a problem and for a fairly accurate prediction of its future course. And that's, why they're asking you a bunch of questions if you go to therapy, because there is predictable course in some mental illnesses. And so they're trying to figure out if that is going to be the case for you. Throughout history, different methods of classification have been tried, including systems based on etiology, on the theoretical behavior model, and on standardized psychological tests. The most popular method, and the one having the most validity, is the empirical approach. The system based on overt symptoms. Because like I said, your behavior is the teller. Most people who go for mental health help is because they have some troubling behaviors. And they want to know why. What is this about? Emil Kraepelin was the first to develop an empirical classification schema. He listed the major categories: manic depressive psychosis and dementia praecox. His system supported the idea that behavioral deviance should be regarded as disease and conform to what is known as the disease model. So back in his day, if you were mentally ill, you had one of two things. Thankfully, that has changed. This model has been followed by the APA in developing their widely used diagnostic and statistical manual. However, structured initial interviews are also necessary to improve the reliability of the system, but professionals prefer to use their own approaches. It is much more comprehensive, listing more than 200 disorders. So thankfully, we have a little better picture nowadays of, people's different mental illnesses. Because back in the day, you got lumped into one of two categories. Second, it uses a multi-axial system calling for diagnosis of an individual's immediate life situation to see how much bearing it has on the disorder. Because, it's all about your functioning too. They want to know how you're functioning, and, they get into all the specifics, so that they can get the best picture they can of what's going on. Third, it emphasizes behavior rather than etiology. Each disorder is listed by symptom syndrome. That is, by the essential distinguishing behaviors and those usually associated with the disorder, as well as by those that must be present for the disorder to be diagnosed. So again, your behaviors are what is going to tell your therapist exactly, where to start looking, as far as a diagnosis. So, if you go to therapy, be honest with your therapist, and tell them the truth about here's what's going on, and do you ever do this, that, and the other thing? Yeah, no, whatever. Assessment techniques still revolve around the initial interview, which concentrates on getting as much information as possible about the individual and the problem. So, like I said, if you're going to therapy, just be honest with your therapist, and then you can get this done a little quicker than if you're blocking and pushing it out, and unless you're forced to go and you didn't want to go, and maybe some people just do that anyways, but most of us, it would be better if you just come on out with it and get her done, as the saying is. In addition, several psychological tests are available to help diagnose the presenting problem. So again, if you go to a therapist and they recommend you get tested, just do it. Intelligence test, personality test, and tests for neurological impairment are sometimes informative. And they can give them an idea of what's going on with you and where they need to start looking, as far as getting you a diagnosis. Why, despite careful socialization of what is and what is not acceptable behavior, are there people who violate society's norms? And one of the easy answers to that is they were not taught what is and is not acceptable behavior, or they were taught that some of the things they're doing was okay by being modeled by a parent or other family member or somebody they grew up with. That could be one thing, but there are also other reasons. A lot of narcissistic sociopaths and people who are megalomaniacs. It's so much all about them that society's norms don't come into play. They're doing their behaviors to achieve their goals and forget society's norms. What makes people engage in the innumerable deviant behaviors that society says are wrong? Again, they could have been taught that this was okay, or like I said, they are so all about them and what they want that they don't give a poop about what everybody thinks is wrong behavior. In short, how does society explain the presence of behavioral deviance? It is mental illness. If it is harmful to yourself or others, for sure, or if it is causing a problem in your life that you want to solve. Now, some people they have problems in their life that they don't even care to solve. They just deal and live the way they do, and poop on everybody else. We don't care, but some people have serious compulsions and things that need some help. Explanations of all phenomena are very much a product of history and culture, and the explanation of abnormality is no exception. Although it depends on when the question is asked and on one who does the explaining, it will generally reflect how the society currently defines abnormal behavior. Now, I was watching a thing on TV the other day. It was the time when the people, and I forget what even country this is, where they dig up their deceased loved ones and change clothes and things on them, and they have them up and standing, and here in our country, that is a crime. If you dig up your loved one and wash them and change your clothes and things like that, that would be abuse of a corpse, and you would go to jail. So again, in different societies there are different norms. So what is abnormal behavior to us is perfectly normal behavior to them. So again, all those people there might not be, have some kind of necrophilia pretension, but in our eyes, maybe they do. So again, the society that you're in dictates the norms. So it's hard for you to say across the board that a certain behavior is abnormal. So that's why if you're studying psychology, you're also going to study sociology, because that teaches you that people are different and the societies are different, and what's abnormal in one case is perfectly normal in another. So in addition, what the underlying values of the society are at this particular point in its development. And that's a key there too. I don't know if any of you are people who watch Star Trek, but they have the rule where you don't interfere in developing societies. And that's kind of a good rule when you're traveling out in the world, or when you're visiting other places, that you don't put the judgment on them of your, moral ruler if their society is not in that place yet. You can certainly have discussions with them. You can certainly teach them, if they're willing to listen. But again, you can't judge everyone by your ruler if they're not in the same place as you are. Demonic possession, a fall from grace, premature weaning, toilet training, brain tumors, and weak nerves, all of these and more have been accepted by our own society at one time and another as explanations of abnormal behavior. So, things change. Time moves on. Society grows. Hopefully, I was listening to a sociologist talk about here in the United States of America, and he said, we had reached our zenith in the 70s, and now we're de-evolving here in the good old USA. And with some of the things I see going on around us here in this country, I'm going to say he had a point. Because we are definitely backsliding down into some behaviors that I would consider abnormal, and most psychologists would too. As we have moved toward rationalism and empirical approach in our search for a better understanding of ourselves and our world, and like I say, most people do try to employ rational thought through their decisions, and certainly you should choose a leader who is capable and willing to use rational thought in making decisions that affect everyone else. The explanations we propose have moved from the supernatural to the scientific. And because, we have the scientific method, it's a little easier to have some checks and balances on people's beliefs and behaviors. More and more people today see behavioral deviance less as a sign of God's eternal damnation and more of an unfortunate outcome of some cosmic game of chance. Remember, like in the Bible, when the blind man, Jesus healed the blind man, and the blind man was there, and the people were there, and Jesus was asked, so who was the sinner? His parents that he became blind, or him that he became blind? And Jesus was like, neither one. This is so God's glory can be shown, and he healed the blind man. So sometimes, it's not a problem. It's just something that happened, unfortunately. Sometimes we get dealt a crappy hand. It's just, life is like poker. We no longer blame the stricken, which back in the day they did. If someone's wrong, it was your fault. You did something bad, or your parents did something bad that caused that. But now we know not necessarily the case. We accept them, at least, to a much greater extent than in the past. And we have, places for people with disabilities, and, programs for people with disabilities. So we can give them, a little, level the playing field a little bit so that they can have a life like everybody else. Likewise, our society has moved from regarding all deviance as a single problem with a single etiology as seeing it as a multitude of forms, each with its own possible cause. Because, not one size fits all when it comes to, mental illness, and everyone is different. What, was overcomable for me, because I'm resilient, it's told that by a psychologist, might be disastrous for another person. There was a woman who had one thing happen to her, and she was ready to kill herself, and almost did. Ended up, she cut herself, and ended up in the hospital. But, everybody's different. So what might be something that, you can overcome might be totally disastrous and more emotional for someone else. So, one size does not fit all when it comes into treating mental illnesses. It is worth noting that the classification of deviance into various categories was itself an important step, because you have to realize that it is a, deviant behavior in order to, try to treat it right. Until the 19th century, there was little effort made to distinguish between the paupers, the criminals, and the lunatics. So, back in the day, your higher class folks, if you were poor, you were just the same as, a criminal or, a lunatic. And, there are still some folks in positions of higher authority that still feel that way. That the poor are poor because they have a problem, not because they were born to poor people in a poor neighborhood. They've had little chance to better themselves. So, there's people that unfortunately subscribe to that type of thinking even now. And again, criminals are not always mentally ill, but in a way they kind of are. Because, a well-adjusted person would not turn to criminal behavior to achieve their means. They would find another way. So, the criminal thing is kind of a, slippery slope there. So, a lot of people don't want to work with criminals. I knew when I was working with therapists and counselors, I knew a lot of them, and I knew only one who wanted to work with criminals. So, and lunatics. We all know the old asylum problems, and I'm sure if you watch the Dracula, you've got the asylum, which Renfield was locked up in, and I'm sure that's a nice portrayal of how it probably was back in the 1800s in a lunatic asylum. These people were simply society's waste products. And like I said, there's people who believe that today. There's people who think if you're poor, it's your fault. You didn't try hard enough. And I know that's not true, because I know people who've tried all their life, tried to better their life, worked themselves, 3 jobs, worked themselves pretty much close to death, and got nowhere further than, very much what I would call lower middle class, income and things. So, that type of thinking is very pre-conventional, and it just shows ignorance is what it shows. Most people who have a whole lot of money are in that protective bubble of money. They've never had it hard. They never had it hard to get anything or do anything. So they don't understand what it's like when you don't have resources to take advantage of, or, a support system or anything like that. So, that type of thinking shouldn't even exist nowadays, but unfortunately, it does. And it was not worth their time to consider how they might differ or what accounted for their plight. And there's still people who are like that nowadays. They don't care. You got this poor people problems. We don't care. And they're in their little protective bubble of money. And sometimes I wish God would just come on and clean them out and show them what it's like. I mean, remember there's a joke one time about somebody and all their high and mightiness, and didn't care about the poor, and you say poor or lazy, that's their fault and all that stuff. And the comedian said, well, why don't we take this person and drop them off, in East LA with $20 and see how they make it, So, I think that would be a good idea, really. Deviance was deviance. So no matter how you deviated from the norm of the day, that was your problem, and they were not super worried about caring, back in the 1800s. And like I said, unfortunately, there is still a section of society that is still living in that pre-conventional mindset of the 1800s, and it's just ignorance. It just is. And you try to give people some slack for their beliefs, but you're comparing apples and oranges. But with the reforms of the Age of Enlightenment, which supposedly we had, nowadays, I don't know if you'd know that, came the recognition of different types of abnormality. Because one size does not fit all. Like your eccentric aunt that likes to collect teapots, and your axe murderer down the street might both be a little abnormal, but there's a degree there. There's a degree of abnormality. So, all, like I said, in mental illness, one size does not fit all. Which in turn spurred several attempts to explain them. Because, like I said, you gotta figure out the problem, explain the problem in order to solve the problem. All the explanations that were then offered, as well as previous explanations, can themselves be placed into different categories. And that's where I'm going to leave you for today. I hope that helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program around the world. And that's what this is, an educational program. It's not designed to diagnose or treat any type of mental illness. If anything I said triggered you, or you feel like it's a problem in your life, by all means go and see your mental health professional. Please, if you want to help me out, please, excuse me, please subscribe to my YouTube channel. And if you want to help me out even more, go to my Patreon page. Oh my goodness. I'm just recovering from a cold, so I'm not quite 100% yet. My link to my Patreon page is in my posts. Thanks for watching or listening. That's all for now. Until next time.